I got it.
Perfect.
I didn't even do anything.
I got it.
Cool, thank you, Lindsay. Regarding the imaging and radiation shared resource presented by the co-directors, Kay Thomas and Brian Marples. And I will let them take it. I'm gonna make one announcement quickly too. Our next seminar is gonna be kind of a town hall format with kind of miscellaneous topics regarding the shared resources, including other services that don't necessarily fall under the umbrella of one of the specific shared resources. So feel free to attend that. I'll have the flyer up and registration open sometime next week. And yeah, we encourage any questions. If you have any other questions, you can email me. Thank you for attending, and I'll let Brian and Kay take it away.
Thank you, Tracy. I've got a sore throat and a funny voice. It's not my English accent, it's generally a funny voice. So I'm getting over that. But if you can't hear me at the back, please move forward. So this is a lunch and learn series. You've had your lunch. So now we're going to try and learn. And the idea is you ask us questions, otherwise there's no point coming. So we're the imaging and radiation shared resource, which is not an obvious combination for a shared resource, but we were put together because the imaging and the radiation components have equipment that go beyond the scope of a regular lab, which is why imaging and radiation are paired. Kay's going to talk about imaging, and I'm going to talk about radiation. Please feel free to interrupt with questions as needed. So Kay and I direct, but there are other people hands-on. Emma Norris and Julie Zhang are involved in the imaging. Eric Kennedy and Lily McFadden are involved with the radiation side of things. Carl Johnson used to be the person you scheduled some of the radiation facilities with, but he's retiring. And Eric has now taken that role. And Lily McFadden is a new hire, started yesterday to facilitate more research with the absence of Carl as he retires. Okay. It did work. As all things, it worked in the practice. Okay. We've broken it already. Okay, that's the end of the lunch and learn. The thing's not moving at all. All right, we've got a lot of discussion to have today.
When I clicked on it,
I've tried the arrows. Oh, there we are. Okay. Okay, try again. So the aim of the presentation, as I said, is to get some lunch and do some learning and to share information that we have and to receive your questions, and hopefully we can provide the answer. So the services we provide are animal irradiators, irradiating small animals up to the size of a rat, really. Cellular irradiations, where you're irradiating cells in culture or solutions of cells. We provide dosimetry for your experiments. Kay's going to talk about some of the imaging facilities and microscopy techniques that she has in her half of the shared resource. The other service we provide is staff-assisted or independent use, so we can guide and help your use, or you can, after training, operate the devices yourself. And we provide education about the equipment, how to use the equipment optimally. We also provide a range of academic and intellectual support, experimental design and consultation. If you are radiating, for example, do you give a single dose or do you give a fractionated dose? 3 doses of 8 gray are not biologically equivalent to 1 dose of 24 gray. There's differences in fractionation. We can talk about that and educate about that. When to fractionate, every day, twice a day, 3 times a week. We can provide consultation on that within the scope of the experimental literature and the history of radiation biology. And I'm sure we do the same for imaging with the imaging devices. We can discuss whether your hypothesis has been done before or whether it's novel based on our knowledge of the literature. Likewise with experimental aims, you give a single dose to validate the system and then move to a more clinically relevant fractionated regimen if we're talking about radiation. Or, for example, Kate could talk about which is the best imaging device to address the question you are specifically asking. So the support we offer complements the services. The equipment's there, but take advantage of the experience we have within our own experiments, but also the literature to guide you to optimally use the services that we offer. We also provide input in terms of how to analyze the data and also verbiage that you can add to manuscripts and grants. So a simple slide about some key equipment and technologies for the radiation. Now it's jumping out. Somebody else got control of this. Well, so for the radiation component of the shared resource, we have the SARP, which is an EXA radiator. So it's a cabinet of radiators. It's got an on-off button. You can turn the beam on, you can turn it off. Primarily designed for small animal radiations, and we'll talk about that in the next slide in more detail. Because it's an animal irradiator, you need UCAR approval on an animal protocol for radiation inclusion, but also the rooms the machine is housed in. We'll talk about that on the next slide. The gamma cell irradiator is located inside a vivarium. We'll see the room number later. Again, it's an animal irradiator for TBI, total body irradiation. It's closed field, involves animals, so it needs UCAR approval. The Shepherd irradiator is buried in the basement. It's an open field cesium irradiator for cells or animals using jigs and experimental setups for targeted irradiation with a jig rather than an image. Again, if using animals, it means UCAR approval. You can see here in red, it's got UCAR. If you come to the radiation research shared resource for animal irradiation and it's not on your protocol, we will not irradiate. If somebody asked us yesterday, we won't irradiate unless it's on an animal protocol. And we'll look at some specifics of that later. Kay will talk about some of her fancy imaging devices in her component of the presentation. And you can learn and lunch from her later. All right, SARP is probably the most sophisticated irradiation device we have. It's the most expensive, beyond the scope of most labs, which is why it's in the shared resource. It's called the SARP. It stands for Small Animal Radiation Research Platform. It's made by Extral, so it's often called the Extral SARP. It's located on the ground floor in a single purpose bunker that's shielded, and the animal prep room is outside that bunker. It's CT image guided. We put your animal on the platform. We take a CT image of your animal. We then target the beam based on that CT image. So this has clinical relevance because that's what happens when a patient goes on the table. It's image-guided therapy. Scores checks with manuscripts and also grant reviewers. We can use different collimated beams, so we can change the field size to match the target that we're irradiating. Again, it matches what happens clinically. So it's clinically relevant. We can develop dose volume histogram plans based on the target, replicating what happens in the clinic. So if you're putting a grant in or a manuscript in, and you want to score kudos with the reviewers, you use a SARP because it mimics what happens in the clinic. Therefore, it's easier to translate your preclinical studies to a clinical setting. We irradiate on an individual basis. I put personalized, but it was a mouse, so it's kind of not a person. So we do individual irradiations, which again is clinically relevant. If we're doing an individual operation one at a time, it's slower than using the Shepherd irradiator, where we can irradiate 3 or 4 animals at the same time. But you can see the theme here, not difficult to see. This is clinically relevant and therefore more applicable to what happens in the clinic for translational studies. The SARP's expensive, but it's clinically relevant, and so it's operated by staff from the shared resource. We do the button pushing, we do the image taking, we do the targeting, and we sort out the collimated beams. But we need a user from the investigation team for animal handling, because we're not on your protocol unless you specifically put our staff on your protocol. You do the animal handling, we do the radiation. We need at least 2 to 3 weeks, preferably 3 weeks lead time for scheduling. So if you've got an experiment, you're planning it, we need to know ahead of time so we can put different people into the schedule. And that's the reason you can't go online at the moment to do this, because we need to know what you're irradiating so we can work out how long it's going to take, the dose and the number of animals to fit in with a shared resource staff. You can request timeframes or ask about timeframes by emailing Eric, or you can talk to me and we can plan the optimal experiment. Do you really need an N equals 6? Can you get it away with N equals 3? When you're targeting with a collimated beam, you're getting more accuracy, your variability is less, so you can reduce the animal number compared with broad field beams. The cost is $200 an hour, and Wilmot members get a subsidy on that cost of 50%. Okay, just to show some examples and show the machine, this is the SARP here. This is the X-ray tube. This is our collimated beam, and the animal lies on this bed. So you can do an individual animal at a time, and then it's anesthetized with isoflurane for immobilization. This X-ray head rotates around the animal so we can change the angle of the beam to match the target from the CT. And I've put a few examples, half a dozen examples, to show what we do and how we do it. Yeah, not quite sure what happened there. Okay, so this is brain irradiation using bony landmarks. So we can take a CT image of the mouse. You can see it in different aspects here. We can use the shape of the bones, because the CT highlights the bones, to target and just irradiate with a collimated beam a segment of the brain. And you can see on the different segments which part of the brain we're irradiating. The brain here, the isocenter is placed in the center, and we're using coplanar beams from a PAAP approach. Here is out of the beam field, and if you look at this dose volume histogram, which scores really well with reviewers, we can see there's a dose across the bottom, there's a percent or volume of the tissue we're targeting. 100% of the volume get the required dose of 15 gray. But in the second target here, we see no dose just outside the field because the beam is highly collimated. So that's using bony landmarks. We developed a system and tested dosimetry with working with Brendan Whitelaw from Kerry O'Banion's lab, where he wanted to look at microglia in the brain through a window chamber implanted into the brains of the mouse. He took images of the microglia, we irradiated, then he took images of the microglia time afterwards. But we got involved here to ensure that he was getting the dose he required from 2 fields. And there was concern that this is a metal frame and maybe there's some scatter and therefore we get an increased dose. But we did some dosimetry. We put a dosimeter in the middle of the brain and also outside the field, and demonstrated with our dose volume histogram. He wanted 10 gray on 2 fields. This is the field here with a 10 gray dose. And we measured the dose from each field using film within the brain and demonstrated we were getting the required dose, despite the fact we had a metal window chamber implanted in the skull just above the brain. So this is the service that we can do to validate your dosimetry, which is important when you're putting manuscripts and grants in, that you have a way of validating the dose you say you're giving. There were bony landmarks. We can use anatomical landmarks. This is work from Angie Groves looking at hemilung irradiation. You can see a cross-section of a mouse here. We're irradiating half the lung. We're not irradiating this lung. And then we look at doses in either aspects of the irradiated lung or the ipsilateral non-irradiated lung or the heart. And you can see here our targeted lung, we get the required dose, and the contralateral non-targeted irradiated lung gets no dose. The heart and thymus and liver get no dose as well. It validates that we can give the dose you require to the target you require, which is great for your science, manuscripts, and grants. And then Angie was looking at different responses in the irradiated lung and what happened in the contralateral non-targeted lung if the other lung was irradiated. So we can do that with anatomical models. For things that don't obviously show up on a CT, like soft tissue, we can use contrast. This is the contrast agent we can inject into the mouse, use the contrast agent to identify, in this case, the bladder. And we put a nice conformal beam through the bladder. So we're selectively irradiating the bladder of the mouse to look at bladder toxicity after radiation, or targeting a orthotopic bladder tumor model. Same concept here, here's cross-section. You can see here's the contrast agent pooling in the bladder, so we can identify the bladder. We can put a nice conformal beam around it, and we can work out the dose with our dose volume histogram in the bladder. So 100% of the tissue get the required dose of 8 gray in this case, whereas the spine and the kidney, which are outside the collimated beam, get negligible dose. It validates what we're doing, and this is what we can offer in terms of the SARP. They were normal tissue examples, 2 quick examples of tumor work using fiducial markers to identify the tumor, which we can then detect with a CT image because they're titanium fiducial markers. Work from Scott Gerber's group. He puts an orthotopic rectal tumor in, bound either side of these titanium fiducial markers. We can identify the fiducial markers with CT and then give conformal coplanar beams to target the tumor selectively with time, with fractionation, to minimize normal tissue toxicity and improve tumor outcome. This is a similar concept, rectal tumor again with our titanium fiducial markers, the tumor's in the middle, and we've measured the dose around the non-targeted fiducial markers in various organs, and we've demonstrated minimal dose outside the field, but the required 5 gray dose, fractional dose in the tumor. So this is the sort of thing you couldn't do without the shared resource, the validation of dose that you're giving. And in this example here, I think Mark with the last example with the SARP, this is demonstrating for pancreatic ductal adenocarcinoma. Here's the mouse, the surgical implantation of the tumor with the fiducial clips. You can see the nice cross section here with the fiducial markers and the tumor showing the beam stylized coming through the tumor. And this was important because the fiducial markers were used every day for 4 days in a row to target the beam to that tumor. You couldn't give contrast every day for 4 days, but you can use fiducial clips to give treatment every day for 4 days. And these images were generated by the shared resource, and they were included in the publication to demonstrate the specificity of targeting of the tumor, to demonstrate they're mimicking what happens clinically. And then they combine the radiation with IL-12 using various conformations, in this case, in this example, mRNA, but also injected to demonstrate efficacy of IL-12 with radiation. So we can generate images that are used for your publications as well as just allowing targeting. Moving on for the last 2 slides to give Kay some time. This is our Shepherd irradiator. It lives in the basement, and it's the real sub-basement. It is a cesium irradiator located in 5714. It's a single-purpose room, specifically designed and shielded for that irradiator. This Shepherd irradiator is probably older than most of you in the room. Not me, but most of you. And you'll see in the next slide what I mean. It's external to the vivarium. So you bring animals from the vivarium, you irradiate. You can't take them back to a clean room. They have to go into a different room. So a lot of people use this irradiator for wild type animals rather than athymic or immune compromised animals. Advantage of this, you can irradiate multiple animals at the same time. If you use a jig setup, a lung, brain, we've got setups where you can irradiate 4 or 5 animals simultaneously. It's not image guided. It's based on you placing an animal inside a jig with a right anatomical place over the slit to allow the radiation through. You can't do BSL-2 unless you get prior approval. on Bruce Fenton. It's open field, so the whole room's irradiated, so you need a radiation badge, but you're not in the room, but you still need a radiation badge. There are several different setups depending on the organ you're irradiating, and it can be used for cells as well. There's a training fee, $100, to encourage Bruce to come in and train you, and there are user fees, a very unusual payment method, 35 minutes for the first 5 minutes, and then $7 per minute thereafter. The dose rate's about 2 gray per minute. You book it by clicking on this link. You get this link once you've completed training by Bruce. You complete the training, you pass his training exam, you get the link, which allows you to book and check the machine. It's a cesium irradiator. It's an isotope. It's gamma. It's about 662 kilovolts. You need an FBI background check to be granted unescorted access. You can work with somebody who has escorted access, but to do it on your own, you need an FBI background check. I mentioned that because that often takes a while to complete. You also need security clearance from our UR facilities, and then you're issued a dosimeter to ensure you're not irradiating yourself, which is not possible with this setup because you can't irradiate you in the room. You have to be outside to push the buttons. Here's the machine. As you can see, it's older than most, maybe me and Tom. It's pneumatic. The source lives in here. You push the buttons, the source comes out here, and it irradiates up through this plate, the sample collimator. And you put different collimators on there depending what you're irradiating: cells, lung, brain. We assist with selecting the optimal collimator. You use the wrong collimator, you get the wrong dose. Dosimetry is dependent on the collimator. It's kind of complex and operational and 1950s, but it's functional, it works, it's effective. It just takes a little bit of use to get time to use for training, but it's open field. Second machine last machine I'm going to talk about is this Gamma Cell 40 that some of you may have used. This is located in the vivarium itself. So people use this for bone marrow transplants with thymic mice or mice who've got immune deficiencies. You can see it's a commercial machine on the nice fancy image if you compare to the prior image. The source is inside here. There are 2 cesium sources, so you get 2 beams, and that helps with field uniformity. Dosimetry, they take care of. Not a big fan, but there we are. This tray comes out, you put your animals inside here, this tray goes back in, and then it irradiates. It's closed field, so you really can't irradiate yourself unless you can climb in this little tray. Primarily TBI, not really for cells. Dose rate is lower. That means it takes longer to give the treatment you require. You can do multiple mice per radiation run. So you generally put a little circular thing in with pie sections that you can put 10 or 12 animals in at a time, and they're all irradiated at the same time. The costs, 75 or 55 a run, depend on whether you're getting assistance to operate it or not. There is a subsidy for this, and Liz Lemire takes care of training and operations for this. Because it's an isotope irradiator, even though you can't irradiate yourself because of this draw, FBI check, badge, and unescorted access requires security clearance. That's the last I've got for the radiation. Any questions while Case sets up? Yes.
If they're looking to email Liz, her last name is Lamere.
I thought it was all E's. No, it's LA. It's Lamere, LA.
Yeah.
Thank you for the correction. I apologize, Liz. I put 2 E's in. Forgot the first one. Before you start, before I finish, the most important thing about using anything to do with radiation is the dose you select, the dose rate, and the fraction size. The reason they're important is each tumor and each normal tissue respond differently to dose, total dose, and fraction size. So you can't transfer the effects of one normal tissue to another normal tissue using the same dose and fraction size. The response of tumors and normal tissue, total dose and fraction size, are dependent on the survival curve, which is calculated an alpha beta ratio, and that allows us to then determine the optimal fractionation pattern for your particular tumor or normal tissue. You just can't swatch in doses and fraction sizes from one to the other and assume you're going to get the same response. Normal tissues respond differently to fraction size, either acute or chronically responding. And that's the sort of thing that you will get when you come and see us before you use radiation. And we can advise you what is the optimal dose and fraction size for your particular normal tissue or tumor type. Okay. Take it away.
Hi, I'm Kay. I see some familiar faces out there, which is great. So I am the co-director of Imaging and Radiation Shared Resource, and I am also the director of the Center for Advanced Light Microscopy and Endoscopy. Good news for any felon scientists out there, none of our instruments require background checks by the FBI. So you do you. So first, I'm going to talk a little bit about what we're doing in wind imaging, and then I'm going to take you through some of the instruments that we have and some of the things that might be good for. And so some of you will see some images that look very familiar, and so thank you in advance for letting me use them. So let's go. Oh, there's a fancy black. Gotcha. Okay. So when we think about an image, what we think about is this, are we looking at a picture of what's happening in our biological system or not biological system? So one way that we do this is by using fluorescence. So fluorescence is a special kind of molecule that when we hit it with one type or one wavelength of light, it will go up into an excited state. And then as it relaxes into its ground state again, it will emit a longer wavelength of light. So we can use this kind of cool chemical, photochemical pattern to take different colors and label different aspects of our sample that we're looking at. So we can make one protein blue, another protein green, and we can use the instrumentation to separate these different colors so that we can specifically track individual molecules within our experimental system. So generally speaking, when we image, we want to see what something looks like, where something goes, if two things are co-localized, if there's a difference in the knockout or the treatment or the blah, 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 if there's more of something here or more of it there or less, if there are more in a number of things, do we have more cells or less cells, how fast things are moving, etc. So there are a lot of questions that we can answer or that we can start to build answers from when we're using imaging technologies. And that's your whole background on fluorescence microscopy. So there's just some of the microscopes that we have in our facility. Just to go quickly through them, we have a multiphoton instrument. We have a really easy to use microscope in a box that does epifluorescence and color imaging. We have a light sheet microscope. We have a STED super resolution microscope, and we have 3 different laser scanning confocals. Today, I'm going to highlight the light sheet, the STED, and the confocal instruments in reverse order from that. We also offer full image analysis packages so that you don't just get the images, but then you can quantify the data that you get in these images. And I'll take you through, at the end, I'm going to take you through one sample and like kind of how we can image it, one way to look at that, how to collect that data and analyze it and have a good look at it. Okay. Please feel free to interrupt me if I'm going too fast or if I'm not making any sense. Okay, so confocal microscopy is one of the major technologies that microscope papers use all the time. So this is something that I'm sure you've seen in the literature, even if it's not something that you've necessarily done yourself. This is one of the standards, but it's a really high-powered technology. And what it does is it allows us to improve the contrast for better resolving power when we're taking an image. So what it does is an optical sectioning technique. And many of the microscopy technologies fall under optical sectioning techniques. But what it does is that we'll take an image of various levels of your sample one at a time in order to build up a three-dimensional representation of your sample. So it looks something like this. We can take the fluorophores from each level, and we can end up with some really beautiful images like this. So this is a laser scanning confocal maximum projection of the brain. And what this student was doing at the time was they were looking at all of the dendritic spines, and they were categorizing and counting them to see how they changed in morphology and number under different situations. But you can see we can get very tiny, very specific details. We can see individual spines, even in a situation where we're just using laser scanning confocal. And there's a lot of information in this image that you can take from it. So this is the kind of the typical image that you see from a laser scanning confocal, right? There's a lot of other things that we can do with this type of instrument. So we get this three-dimensional image. So that was a flattened three-dimensional image, but there's actually a ton of information in there where we can go through layer by layer and see how things are related to each other in 3 dimensions. And so this is just another representation of that. Instead of just seeing that flat thing, we can see how much is happening at a full depth. And that gives us even more information about how things are interacting, or how much of a volume is taken up by a certain protein or by a specific cell type. So, and it's very pretty. Another thing that we can do, a lot of people don't think about doing live cell imaging on laser scanning confocal, but this is one live image. You can't see it really well, but what's happening is that this cell is eating the little cells. So it's phagocytosing those little cells. You can see that it's like taking them and sucking them in, grabbing them. It moves them along their processes to the body. And then if you watch this long enough, you'll see that these little voids where the cells are taking up space in the cell, and then the cell will start to digest those little voids. So this is something that's happening live over several hours. I think it's like a 12-hour experiment, maybe something like that, where we can see various things happening over time. And that's something else that we can do in a confocal instrument. So it's not just about static three-dimensional images. This is a single slice, but it takes only that single slice, and we can see the information that's happening at a certain specific part of our sample in our cell. Another thing that we can do is we can image even without fluorescence. So this is also taking the confocal microscope, but we're throwing away that tool of using fluorescence. And this is going to be shown to you in real time. So this is like how fast the image was acquired, and you're going to see it happen. And so what we're looking at here is actually, this is an organoid, and we're looking at the inside of that organoid, and we can see that inside there's all these little cilia happening. And even though nothing is fluorescently labeled, we can still start to get a lot of information about the fluid space and the motion and the movement within inside of a tumoroid or a spheroid. So I think a lot of times we think of those as like solid cell balls, but in this, we can see very clearly that that's not what's happening in there. And there's a lot of else going on there. A little bit creepy, but that's what's happening. And these are just small cilia. So again, this kind of shows you the level of detail that we can get on these instruments, even in the absence of any stain or fluorescence. All right. So that was confocal microscopy. Now we can take that one step further and go into super resolution. So when we talk about super resolution, we're talking about breaking the diffraction barrier. So I showed you kind of how small of things that we could see in those confocal images. But when we talk about super resolution microscopy, we're going to use different tricks in order to get even more resolution out of our system. Now, I can give a whole talk about this, and I'm not going to, but what we're going to do is we're going to look at STED. And STED is basically a PSF shaping technology where we can take the spot that we would image, that's usually this side, and we can make it this side. What that means is that an image that looks like this in a confocal microscope can actually look like this in a STED microscope. And you're like, okay, I don't care. But when we think about looking at something like co-localization, which we see in papers all the time, right? We're going to see that in this case, we're going to get Pearsons and emanders of 65 to 70%. So these molecules are what we would report in the literature as co-localized. These molecules are occurring in the same position, right? But when we look over here at a SED microscope, we can actually see the true arrangement of these molecules, and that's that one surrounds the other. And that completely throws away our idea of co-localization. And we can see what's really happening, right? And because we know from our own experiences that co-localization doesn't exist, right? You can't have two things in the same space. But sometimes it's enough information to know that they're close enough, but sometimes you need this information and you need to know where they're actually located. And that's what super resolution gives you above what you might see in a normal confocal image. So if you're counting the number of nuclear pore complexes, this is plenty of information. If you need to know how many subunits are in each of these, then this is not enough information. And we can go down to like the single protein subunit level, so we can see things like this in a super resolution instrument. So we can get sort of molecular information in these instruments. So even for people that thought that there was no reason for them to do microscopy because they would never get the resolution that they would need anyway, we're really seeing a lot more of, people that are used to doing protein blots and things like that that can now look and see the relative positions of their proteins without having to go to EM or something like that. All right. So that was super resolution. Now we're going to talk about light sheet. Light sheet is kind of our new baby in the microscopy facility. So we just last year we got an instrument that does light sheet imaging, and light sheet is known for its sort of fast and gentle type of imaging. And what's really cool about light sheet is that when we look at confocal microscopy or other sectioning techniques like 2-photon microscopy, what we do is we illuminate from one area and then we collect from another. So we're going to illuminate here and we're going to collect here. So in confocal, we're going to excite the whole sample and collect a small bit. From multiphoton, we're going to excite a portion of the sample and collect some smaller and collect all of that information. But what we do with light sheet microscopy is we're going to have two separate beam paths, really. So we're going to excite from one direction and then we're going to collect from another direction. So it's a really very different way of looking at the technology. But what this does is allows us to do that sectioning, but to do it very fast through our sample. So basically you can think about, you have your whole sample, you have your camera up here, and you're just going to excite the whole plane one at a time and just go right through it. And then you can just collect so much data so quickly in this type of situation. Right. So one thing that we've looked at, so you can look at stuff that's pretty optically clear. If it can be pretty large as long as it's fairly optically clear. So here we're looking at a zebrafish embryo, and we're able to see the zebrafish embryo. We can see the mitochondria within the red blood cells as they flow in the zebrafish. So that's something that's really amazing that we can go that fast at that level of resolution to really see what's happening. This is Paramita. This looks familiar. So this is an image from the Lee lab that was taken by Paramita, and she's looking at, I'm not going to go into it, but what she does is she clears a whole mouse limb, and then we can look at the different things that are happening within that knee. In this case, this is just looking at the innervation, but we can see that individual neurons, as they're located through this cleared mouse knee, which can give us a ton of information about what's happening, obviously, in different disease models and so forth. We've looked at vasculature in the brain. We've looked at beating hearts with this instrument. So it's a really amazing technology that has wide ranges of application that I think are really exciting. As you can tell, I'm like not even breathing, I'm just excited. So it's a really cool instrument. And so here is something by Allison Ryan from the Kim Lab. So this is one that I'm going to take you through to just kind of show you what this instrument is, like some fun with this instrument. So what she had was basically, this is a tumoroid spherical tumor that she made. And then these are cells that are attacking the tumor. And what we want to watch is how those cells get to the tumor and if they go into the tumor or what's happening, right? So that's what she's doing. So we image these cells on the light sheet microscope for a day to see what happens. And we get a full set of 3D information over time of what's happening in the cell. So you can see before we could see the movement, and now we can see the whole thing. And we have all that information that we can use. What we can do is we can put this into our analysis software, and we can track these cells. And we can see how fast they're moving, if they're moving directionally. And we can tell which ones go in and start to overlap with the tumor. So we get a lot of information from a movie like this, right? So it's not just about watching a cool movie, although it is a cool movie, but we can also see all this information. So we get all of these individual tracks that we can measure and we can count, and we can use to kind of test our hypothesis within these samples. And you end up with a whole bunch of numbers that Allison gets to interpret later. But you can see there's a lot of data here. So it's not just about like, oh, that looks cool, but there's a lot of quantitative information that you can extract from these type of experiments. And that's the case for all of those images that I've shown you today, right? So I just took you through this last one to kind of show you that next step, because it's nice to take images, right? But we need to get data, and that's our goal. But these images can give you a lot of that quantitative data that you might need for your life. So here we go. This is Julie and Emma, who work with me in the core. The core would not run without them. And Julie's really the boss of us all. So stay on her good side. We're also looking, this could be you know, we're also looking for an analyst. So we try to offer someone who also has experience in analysis, which we all do, but we're also looking for an analyst that can take a kind of deeper dive into some of that quantitative information that I showed you. So how can you come to the Center for Advanced Light Microscopy? So we have, this is our link to our website, lightmicroscopy.urmc.edu. This will show you how to create an account, request a training. Then we need to discuss your imaging project. We decide which instrument was better for you. And then we move from there. But we'll take you from any spot that you want. If you're just starting to think about what kind of cool imaging you might want to do, we're happy to chat with you about the possibilities. We're happy to help you troubleshoot as you expand your imaging. I spent quite a few hours troubleshooting with a lot of people in here. So we're there to help you get started and to get the data that you need at all stages of that process. And that's what I have for you today. Oh, this is my door, and it's always open. Even when it's not open, it's still open. So you can always come see me.
Okay. Anybody have any questions? Procedural, scientific,
Not
imaging,
personal.
radiation wise, where we are, how you find us, how you get trained? Yes.
I just had a quick question about your light sheet microscope. Is it more colors like the multi-photon?
Yeah, so it actually has, we actually have 6 lasers on that system. It's really easy, I'll say, it's really easy to align 2 colors. But when you start to add more colors, the alignment on the color shift becomes more and more of a concern, but we've been working on that. And we're actually getting great alignment, I think, now with 3 and 4 channels. So yes, we can do 4 colors.
And I guess one other question about the resolution of the multi-photon versus the light sheet. Is it kind of comparable, or is it a little bit less resolute in the light sheet?
That's a really good question. I think it's kind of comparable, but it depends on the size of your sample. So with the light sheet, we can go up to a 20x with a pretty high resolution, but that chamber is only suitable for very small samples and not cleared samples. So for the larger samples, we're getting more in the several hundreds, maybe nanometer range of pixel size, as opposed to what you can get like hundreds of hundreds with the bulk. But we did see, like I said, we did see those mitochondria within flowing blood cells, which I didn't think that was going to happen. It did. So it'll surprise you sometimes.
I should point out that the radiation shared resource door is also always open.
Except it's not, it's locked.
Even if you don't, you need to know the push button code, which we're not allowed to give, so you have to call or email ahead of time. Because obviously for the isotopic radiators, we're in a reserved area. So we're buried in the basement, but access can be limited, but you need to call ahead.
We also have a shared resource calendar, so most of you that use the imaging and radiation shared resource have really pretty pictures that you've gotten, so when that calendar submission is looking for entries, feel free to submit it. It's probably late August, early September that we'll start accepting them, but
Yeah,
we're looking for more submissions compared to last year.
yes, the calendar was really awesome, and then at the end of the year, we have a imaging contest as well, so you can submit your cool images and they get to sit on our wall, but you get cool swag. Well, thank you all.
Your USBs in there. Ken. Your USBs.
You could have used the chair, both of you guys kind of stood in the same spot.
How are you?
Sorry that I didn't get back to you.
No, no.
Didn't want to bother you around the clock of Friday. I thought I would see you. I will meet with Andrew today. I think he needs a bit more specific.
Okay, yeah, I can absolutely do that.